Brisdelle is a medication used to treat hot flashes that happen during menopause. It belongs to a group of drugs called selective serotonin reuptake inhibitors, SSRIs. It can help reduce the frequency and severity of hot flashes. The usual dosage is 1 capsule taken by mouth once daily at bedtime. It's important to take it at the same time each day. Be sure to follow your doctor's instructions carefully. Before starting to take Brisdelle, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. There are different brands of this medication available, so make sure to consult your doctor or pharmacist before changing brands. You should take this medication by mouth, either with or without food, as directed by your doctor. It's typically taken once daily at bedtime. To get the most benefit from Brisdelle, it's important to use it regularly. Try to take it at the same time each day to help you remember. Even if you start feeling better, keep taking this medication unless your doctor advises otherwise. Stopping this drug suddenly can make some conditions worse and lead to symptoms like mood swings, headaches, tiredness, sleep changes, and brief feelings similar to electric shock. If your doctor decides to stop your treatment with Brisdelle, they may reduce your dose gradually to prevent these symptoms. Make sure to consult your doctor or pharmacist for more details. And, of course, if you experience any new or worsening symptoms, report them to your doctor right away. If your condition doesn't improve or if it worsens, be sure to inform your doctor. If you are taking Brisdelle, you may experience some common side effects such as nausea, drowsiness, dry mouth, sweating, and blurred vision. However, many people using this medication do not have serious side effects. It's important to tell your doctor if you experience any serious side effects such as restlessness, decreased interest in sex, numbness/tingling, fast/irregular heartbeat, or mental/mood changes. In rare cases, this medication may cause serotonin syndrome/toxicity or a very serious allergic reaction. If you notice symptoms such as fast heartbeat, hallucinations, severe nausea/vomiting/diarrhea, or a severe allergic reaction, seek medical help right away. If you are a man using Brisdelle, it may rarely cause a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using the drug and seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Remember to always discuss any concerns with your healthcare provider. When it comes to treating depression and other mental or mood disorders, antidepressant medications like Brisdelle, which contains paroxetine, can be very beneficial. They can help prevent suicidal thoughts and provide other important benefits. However, it's important to note that some people, especially those under 25, may experience worsening depression or other mental symptoms when taking antidepressants. It's crucial to discuss the risks and benefits of taking Brisdelle with your doctor, especially if you are under 25 or if the medication is not for a mental or mood condition. If you notice any worsening depression, unusual behavior changes, or other mental or mood changes, such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostility, impulsive actions, severe restlessness, or very rapid speech, you should inform your doctor immediately. This is especially important when starting Brisdelle or changing the dosage. Always keep a watchful eye for any of these symptoms and communicate with your doctor if you have any concerns. As for the daily dosage and optimal timing for taking Brisdelle, your doctor will provide you with the specific instructions tailored to your individual needs. Before taking Brisdelle, it is important to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It is also important to discuss your medical history, including any history of bipolar disorder, suicide attempts, liver or kidney problems, low sodium levels, seizures, glaucoma, and any use of alcohol or marijuana. Brisdelle may cause dizziness, drowsiness, or blurred vision, so it's important to avoid activities that require alertness until you know how this medication affects you. It's also important to inform your doctor about any other medications or herbal products you may be using. Older adults may be more sensitive to the side effects of Brisdelle, and children may experience loss of appetite and weight loss while taking this medication. Brisdelle is not typically used by women of childbearing age, and it is not recommended for use during pregnancy as it may harm the unborn baby. If you become pregnant while taking Brisdelle, discuss the potential risks and benefits with your doctor. This medication may also pass into breast milk, so consult your doctor before breastfeeding while using Brisdelle. When taking Brisdelle, it's important to be aware of potential interactions with other medications. This includes drugs that can cause bleeding or bruising, such as aspirin, NSAIDs, and blood thinners. Additionally, Brisdelle may slow down the removal of other medications from your body, affecting how they work. It's crucial to inform your doctor of all the products you use, including prescription/non-prescription drugs and herbal products, in order to avoid any potential interactions. Be sure to communicate with your doctor about any concerns or questions regarding drug interactions. It's also important to avoid taking MAO inhibitors during treatment with Brisdelle, as this can cause a serious and possibly fatal drug interaction. Additionally, be cautious when taking other products that cause drowsiness, as Brisdelle may enhance this effect. Finally, Brisdelle may interfere with certain medical and lab tests, so it's essential to inform lab personnel and your doctors that you are taking this medication. Remember to always follow your doctor's guidance and ask for more details if needed. If someone has taken too much Brisdelle and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include an irregular heartbeat, fainting, severe dizziness, and seizures. It's important to follow your healthcare provider's instructions for taking Brisdelle. This medication is meant for your use only and should not be shared with others. Make sure to attend all scheduled medical and psychiatric appointments to monitor your progress and address any concerns. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take 2 doses at once to make up for the missed one. When storing Brisdelle, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Brisdelle, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.